It's just hard being this.
We'll be going live in about 3 minutes. We will be beginning live in about a minute and a half, minute or so.
Good afternoon. I am Tracy Aaron with the Lake Cumberland District Health Department. Thank you for joining us today for the July the 22nd update on COVID-19 across the Lake Cumberland District. We have some executive team members with us today that are going to be answering questions that have been submitted over the past week. I do want to let you all know that there's a chat box in YouTube Live, so if you have questions as we go through the meeting, just type those in the chat box and we'll answer those as we walk through the meeting. Mr. Crabtree, I'm going to turn it over to you and let you give an update since last week regarding COVID-19.
Thank you, Tracy. Can you hear me okay?
Can, yes.
All right, so side view as I'm looking at our situation board. In Adair County, we've had a total of 180 cases. 136 of those are recovered, 19 deceased, 25 current cases, all of those on home isolation. Casey County, 135 total cases, 7 of those deceased, 66 have recovered. They have 62 current cases, 5 of those are in the hospital, 57 are on home isolation or are isolated at their residence. Of course, we had a significant cluster in a nursing home in Casey County, so that's where we've picked up a lot of cases there. Clinton County, we've had 16 total cases. 9 of those have recovered. 7 are active. All are on home isolation. Cumberland County, 20 total cases. 12 recovered. No deaths. 8 current cases. 7 on home isolation. 1 in the hospital. Green, we've had 26 total cases. 1 deceased. 15 recovered. 10 current active cases, all on home isolation. Macquarie has had 21 cases. 19 have recovered, 2 are current, 1 on home isolation, 1 in the hospital. 192 cases total for Pulaski, 2 deceased, 136 are recovered, 54 are current. 53 of those 54 are isolated, 1 is in the hospital. 88 total cases in Russell, 5 deceased, 65 recovered, 18 current cases, 17 isolated, 1 in the hospital. 82 total cases for Taylor County, 1 deceased, 55 recovered, 26 current cases, 23 on home isolation, 3 in the hospital. 43 total cases for Wayne, 28 recovered, no deceased, 15 current cases, 13 isolated, 2 in the hospital. That's a total of 803 cases for our district, 35 deceased, 541 recovered, 227 active cases, 213 are isolated, and 14 are presently in the hospital. There could be a couple or 3 corrections to the data from yesterday. I think we got a couple of cases that turned out to not be cases, so they'll end up being removed today. And maybe one hospitalization may be incorrectly reported, but we do have to reconcile our data from day to day, so sometimes things get corrected. We did have an additional death today. That was a Casey County death from the long-term care facility there. I'm not sure on the gender and age. That'll be in our daily brief this evening. We have so far today, we're adding 5, 6, 7, 8, 9, 10, 16, 17, 18, 19, 20, looks like 20 cases so far, and we can get more in throughout the evening. We will be adding 3 in Adair, 5 in Casey, 1 in Greene, 1 in McQuarrie, 6 in Pulaski, 1 in Russell, 1 in Wayne, and 2 in Taylor so far today. So yesterday we had 20 cases. Today we've got 20 cases so far. So it's looking like a pretty significant week. The number that is probably the most concerning number is about a week and a half ago, we had 7 in the hospital, and now about a week and a half later, we have 14. Certainly in the next week and a half, we don't want to see the 14 turn into 28 hospitalization. We don't want to see that number doubling. There will, of course, be more mortality if the hospitals become overwhelmed and you can't get in for appropriate care, and that's what we hope to avoid. COVID-19 still has a long way to go in our population. We're not even to 0.5% of our population having tested positive yet, so we've still got a long road ahead of us. And if we've had I don't know the running total of our hospitalization. I have it wrote down somewhere, but there can be a whole lot more hospitalizations, a whole lot mortality by the time we get to the end of this running its way through the population. We just don't want to have so many people sick at any given point in time that the medical system's overwhelmed. That's the important reason to wear the masks, to try to slow the curve. So I will turn it back over to you, Tracy. That'll be all for introductions right now.
All right. Well, I'm going to go ahead and start with the questions. Dr. Wayman, the first one is for you. Why should I wear a mask or face covering?
Face coverings prevent the microscopic spray from your mouth and nose, which is expelled when you speak or cough, from reaching your loved ones, your friends, or your neighbors. This spray, if infected, is full of virus particles. The day before symptom onset, and even in those who do not have any symptoms and remain asymptomatic and are totally unaware that they may be infected. Initially, we did not have enough data to support wearing face coverings, but now, several months into it and many studies, we know that it dramatically lowers the spread of coronavirus. Help your neighbor.
And it is unfortunate that the information has evolved over time, and no doubt the information will continue to evolve over time as the virus is studied and better understood. So I say it's unfortunate because, people used to hear the message, you don't have to wear a mask, and now they're hearing the message you do, so they conclude no one knows what they're talking about, why fool with it? Well, the truth is, knowledge, this is a new virus. It's not been around before. It takes time for the studies to happen and for the conclusions to be drawn about what works and what doesn't work. So it's normal that the information would evolve. People can't know what they don't know. If something's brand new, you don't know anything about it because it's brand new. It takes time to study it and learn. So it's also unfortunate that it seems like the politicians have turned COVID-19 into a political tit for tat instead of handling it as a public health crisis. It's turned into one side blaming the other side for doing it wrong, and the other side blaming the other side in return for handling things wrong. As best I can tell, nobody's handled it real great, and both sides need to just start telling the public, this is a problem, use some common sense, stay away from crowds, wear a mask or a face covering, and if everybody could just get on the same page with that, it would help. But the world is what the world is, and the media and the politicians are going to continue to do what they do and keep everything muddied up and try to make each other look bad. And it's just, this is not the thing they ought to be doing when you're dealing with a pandemic, but it's what happens. And there is Tracy, are you able to see the questions in the YouTube chat?
I do have the questions, yes.
You want to read that one that's over in the YouTube chat?
I'd be glad to. How do you determine when to release someone that is asymptomatic since they do not show any symptoms?
That would be a Dr. Wayman.
Well, we have recommendations on that, and it is 10 days after the lab test, as long as they don't continue not to have symptoms.
Okay. So 10 days after the lab test, correct? Okay. Thank you, Dr. Wayman. I have another question for you also. Why should I not just get infected and help the herd immunity? You might want to explain what herd immunity is, Dr. Wayman, just FYI. Oh, you are.
Okay. Herd immunity is something that if enough of the population have had the illness and have immunity to it, then the few that haven't are protected because there're just not enough of them scattered around for the virus to jump from person to person. So herd immunity is great when it comes to diseases that give us lifelong or at least long-term immunity, such as measles and chickenpox, but not for diseases that do not. Unfortunately, we still do not know if coronavirus infections provide long-term immunity. Studies show that the antibodies produced from coronaviruses which cause the common cold decrease over time, and hence we get colds annually. So far, there has been one study which reported that the antibodies to coronavirus of the COVID-19 type also decrease and become very low at 3 months. Antibodies are not the only defense system we have in the immune response. However, the jury is still out if it is possible, if we can repeat our infections and get sick again. More studies are needed.
Yeah.
Furthermore, mild to moderate disease can, even though if you recover, you can have chronic consequences such as stroke, heart disease, chronic lung disease, various neurological symptoms, including difficulty thinking, loss of fingers and toes and limbs. In fact, studies have shown that even those people who are totally asymptomatic may have detectable lung abnormalities on their CT scans. So just because you didn't die doesn't mean that you don't have consequences of the disease. Most people have a mild course, but you never know. So it's best not to catch it until at least we have a vaccine, which we may need to receive on an annual basis.
So if you can recatch this year after year, then the hope would be that there would be a vaccine, but the vaccine may not provide a lifetime immunity, it may be something you have to take annually. But it still is good to have hope that a vaccine could happen and allow us to be close to normal, even if you have to take it annually. So there is still that hope that we hope they develop a vaccine, and even if you have to take it annually, it'll provide some protection each year. Does that sound right, Dr. Lehman?
That sounds right, and we have several vaccines that are in the last phases of their studies, so because the preliminary tests look very encouraging.
Good. Thank you, Dr. Wayman. Next question, this one I guess is for you, Sean. How many people have been tested in Macquarie County?
The question was, you cut out a little bit, Tracy. The question was, how many people have been tested in Macquarie County? Labs and medical facilities, doctors' offices, they're not required to report to the health department negative results or results that come back and you don't have the disease. They're only required to report to the health department when there's certain communicable diseases that law requires. They have to be reported to the health department, but only when those tests are positive. Positive meaning you have it. So since they don't have to report to us a test outcome where someone doesn't have the disease, we have no way of knowing how many tests have been given. We can give you some idea of how many, by knowing how many positives there are, we can know how many positive tests were, but we have no way of knowing how many tests come back negative. When we were doing the mass drive-through clinics early on, there was about 2.5% positive coming out of those. So, you could maybe multiply the number of positives for your county and say that's, maybe 98% more tests have been done. I'm just speculating. I know the positivity rate from the mass testing sites now has increased to like 4.5% positive. So that tells me that the disease is being spread more freely in the community now when these mass testing sites are starting to show more positives. So it is, and obviously our case count is going up. So it is spreading freely in the communities right now. One other thing I will add, it just brings to mind, Tracy, we get the question often, why is it that a patient finds out that they're positive 2 or even 3 days before the health department? And that can happen a variety of ways. The lab that ran the test could let the patient know. Probably the lab let the provider know that took the specimen and submitted it to the lab, and then the provider let the patient know. But the provider isn't required to, or the lab isn't required to report it to the health board. They have 24 hours to do that. So, sometimes people are getting, when you take into account ends of days and the beginnings of days, sometimes it's a couple days before, the patient might get notified at the end of the day, and we might not get to the lab until the end of the next day. Sometimes the labs are just behind, and we don't get the results for 2 or 3 days. Occasionally one will come in really late because someone messed up somewhere, but most of the lab results we're getting are processed within 2 or 3 days. It's just that's when we're going to find out. The patient may find out sooner. So a lot of people will look at the health department and say, you guys aren't doing your job correctly because it's obvious everyone knows so-and-so's positive a couple of days before you all even reach out to them. Well, unless the lab results get to us extremely late in the night, we start doing our case investigation the day we get the results. So there is no delay in the health department's response. There's a delay between the test being taken, the lab being performed, and the lab getting the information either from them or through the medical provider that took the specimen before the information gets to the health department. Sometimes a patient will test positive and they're notified, and they'll call us and tell us they're positive. And then since we then know, we can reach out to that medical provider or that lab and try to get the lab results and go ahead and get started. But if we can't take action on something we don't know about. If someone doesn't tell us, we can't respond. So Don't think that the health department is not on top of their game. We are. So we can only move when we're informed. Tracy, I see there's another question on YouTube Live if you want to jump over to that.
Okay. The question is, the 10-person guideline is somewhat confusing to me. What are the recommendations on holding a fiscal court meeting or 10 or less? That's probably for you.
Yeah,
Stuart, I think.
I appreciate that question, Judge. One thing, let me start out by saying that the main thing that we need to remember on this is it doesn't matter, with 10 people or 50 people or whatever. The reason why it was brought back down to 10 was because that, one, for contact tracing, if you have a gathering of 50 people, that's 50 contacts that you're going to have to trace. And then you may have multiple contacts out of sick people. So it brings that much more down to a more manageable, a little bit more manageable number at 10. And just because you have 10 compared to 50 doesn't mean that you couldn't have a positive person come in, whether they're symptomatic or asymptomatic. But the guidance that we have right now, it actually went back to the old guidance of the gatherings of 10 people that we had prior to this. And this is specifically, the one thing that's a little bit different is it's specifically for social gatherings. So it's not about commercial. It's not about places that already have guidance that's listed on the Healthy at Work page, like governments, like events and venues. So one of the examples the governor used was if you're having a wedding at a venue, they should have the people, the staff there that's able to do the sanitizing, to be able to kind of keep that going in a safe way. They're usually licensed somehow, whether it might be by the health department, might be a business license or whatever that they have. So this specifically refers to like your get-togethers, your social get-togethers, like your parties that you're having, as they said, your backyard barbecue. So it doesn't necessarily apply to fiscal court, but I know that since fiscal court is a public meeting and the public is allowed to come into fiscal court, I think the recommendations we would have is to either look at a way to have the fiscal court meeting like we're having it, do a virtual meeting, Zoom, where the public could attend to that, or a YouTube Live. Put people, specifically if they're going to come in, they have to be on the agenda. That might be one thing that you do, so you're not, you need to limit that number of people that's going to come in and pack into that room potentially. Even though the 10-person guidance doesn't apply to that, you still need to make sure that you've got plenty of room for people to space out, that they're wearing their masks, and that you just don't get overrun in the physical courtroom, just by the members of the public coming in because it is a public meeting. So,
regardless of where you're going, any business or any place that has guidance in place, you still have to maintain the social distancing and wear a face mask.
Yes.
That's the key. There's nothing magic about these numbers. I mean, if you're around 100 people, you're 10 times more likely to be exposed than if you're around 10 people. So limit the number of people you're around. I think that the thing about the new rule is, there is an assumption that if it's a business or fiscal court, that they have guidance in place where they're enforcing distancing, where they're enforcing masking. What he's talking about is when you're doing your private gatherings where there is no guidance and everyone's they got their masks off, they're all packed together at the barbecue or at the birthday party, and there's no one there to enforce the distancing and the masking, that's the fear, that you're going to get too many people together and you're going to have all that risk and it's going to spread. So, it's trying to take the numbers down from being around 100 people or 50 people, where you've got, more likely one of those people are going to have it than if you just got 10 people. So it's all an effort to lower the risk. Our guidance is always for just in general, don't be around any more people than you have to be around, period. I don't care what the situation is. Don't be around people any longer than you have to be. And if you're going to be out, hopefully those people you're around are wearing a face covering, and hopefully you're wearing a face covering too, because that greatly reduces the transmission of the disease when both parties are wearing a face covering. It's like up to, I think some of the studies, up to 80%, somewhere in that neighborhood. There's different studies you can read, but anyway, there's a significant reduction in risk when both parties wear the face covering. But again, don't be around crowds if you don't have to be. If you got to be around people, limit the length of time as much as you can. And while you're there, wear a face covering. Just lower your exposure as much as you can.
And I know that the question has led to some other comments. I will say that when we see our cases and where, we try and determine where these cases come from, where was their exposure or their potential exposure, and sometimes we may not know, but what we're finding is with our cases, it's not because you went to Walmart or Kroger to go grocery shopping. That's not been, we don't have cases tied to, I went grocery shopping. But what we do have cases tied to is I went to a get-together, or I went to a church camp, or, even I went to church and maybe they weren't following the guidance. They weren't wearing the face mask, or I went out of town, out of state on a trip to Florida or some of these other places where the cases are blowing up, where potentially 1 out of 5 people that you run into has an active case. So that's the kind of things where we're seeing our cases come from. And the more people that get involved in those kind of activities, then what happens is when they come around people or their family who aren't, then those people end up getting it also. So
now, Stuart, people are suspicious about what the federal government says and what the state government says and the world governments say. Well, maybe people are suspicious about what we say. But I mean, you and I are just two local boys from Lake Cumberland. I'm not in any secret conspiracy society. I grew up down the road and just like anybody else. And I can tell you with absolute certainty from the data that we see, observing the guidance works. Because in every, we'll see one case tied to a lot of things, but when we see multiple cases tied to a certain thing, we call that a cluster. And in every single incident where there's been a church cluster, in every single case, it was a church that wasn't observing the guidance. They weren't social distancing. They weren't enforcing the face covering. Every single instance where there's been a cluster, it was a church that wasn't following the guidance. In almost all the business clusters we've had, it was a situation where the guidance wasn't being followed as it should have been. There are some exceptions, but most you can find that people weren't being vigilant. They had become complacent, or they were being defiant. Whatever the reason is, I mean, we know without a doubt when there's clusters, most of the time you can trace it back to they were complacent with following the guidance.
And I mean, it's hard when you're around your friends and your family and, you've known these people for years or all your life. And I know it's odd to put on put on a mask. And I feel that way too. I mean, it does feel weird or different to do that. But when you're around your non-household contacts and you're a person that's out and about, you know, you have a job and you're out working, and then, you know, you're a potential person to get the disease. You potentially could be asymptomatic, and you're a potential spreader of the disease. That's just, any one of us is a potential spreader of the disease.
Good comment, Stuart. Okay, next question is for you too, Stuart. Can you explain the steps to how non-compliance with businesses are being handled?
Yeah, when those complaints come in, and some of them come into our call center, and some of them come in through our complaint system over the internet, our website. So when we get those complaints, we divvy those out to whatever county they belong to, and then our planner person in that county will make contact with the business that the complaint's on, and let them know that we've had a complaint. We take that opportunity to educate the people again about how important it is to wear the mask, to wash your hands, to follow the guidance, to do the things that we've just been talking about. Once we've done that, if we get subsequent complaints on that business, then we turn that over to the Department of Labor. And the Department of Labor actually has more power than the local health department has, as far in this COVID instance, to levy fines or even issue a closure of a notice of closure for that business. So, you know, that's not what we want to do. You know, we don't want to do that. What we want to do is we want to be able to reach out to people. We want to be able to educate them. We want them to understand the importance of doing this. And then just to see people do it, not to use fines or close their business. We don't want to do that, because we feel certain that, well, we know that we can continue to have business, we can continue our economy, and protect ourselves from COVID at the same time. It don't have to be one or the other. It can be both.
The compromise, Stuart, is, I agree with you. We don't want to see businesses closed or fined, or, you know, we just want the general public to be safe. You do that by avoiding crowds. If you're around people, keeping your 6-foot space bubble and wearing a face covering. That's the common sense thing if people would do. The disease will still spread, but that will slow it. That will slow it down to the point where it won't be so overwhelming at any particular point in time.
So that's what, it goes back to what Sean said earlier. I mean, we've got 14 in the hospital this week. We had 7 last week. If these numbers double, and that's what happens whenever things get out, you get a doubling, you get this geometric multiplication of numbers, and you know, next week we could be sitting at 28. We know that the masking could take us, if people take it really serious right now, it's still 3 to 4 weeks out that we can see the difference. So we may still see numbers, but you know, if we do things right and do things serious, 3 to 4 weeks, hopefully we start seeing that level off and decrease.
Tracy, I think you're getting close to the last question, so just remind everyone that's listening in, if you've got a question you want us to try to answer, now's the time to put it into the chat box.
Okay. Last question, Dr. Wayman, is for you. How do residents continue to test positive if staff is wearing the required PPE?
It is very difficult to stop spread of COVID in nursing homes once there are positive cases. Distancing is not always possible, and although the staff do wear surgical masks, these aren't always 100% effective. And resident-to-resident transmission may also occur. It's a little bit like having family members. It's very hard to isolate every individual in that congregate kind of setting.
Yeah, and I would encourage everyone, if you have a loved one in a nursing home and they're experiencing an outbreak, I recommend that on the Kentucky COVID-19 website, there's a link on there that says, current situation report for long-term care facilities or long-term care facility report or something of that nature. Go read that. And then, you can Google also, nursing home outbreaks. You will see that this issue isn't unique to Lake Cumberland or your particular county. It's not unique to Kentucky. It's not unique to the United States. It's not unique to any country. It's difficult when you have a disease that spreads this easily. Once it gets into a facility, a congregate care facility like that, or a jail, it's really hard to slow the spread of that disease. So, it's difficult. I'm thankful for the nursing homes. I'm thankful for their staff and the services they provide. At this moment in time, I'm thankful I'm not working there because they have about as difficult of a set of circumstances as anybody could have. I know we at the health department right now, we're working really hard and being pushed to our limits. I'd say they've probably got it worse than we do. So it's a tough situation. Tracy, do you have any more questions on your list?
I do not, Sean, but something I did write down is the mass testing that's going to be occurring across the district. And that is on our website. So I want to encourage you, maybe you want to share those or just remind people to go to our website and find that information because they are sporadically happening across the 10 counties.
Yeah. Tracy, you may need to get into your microphone a little closer. I missed part of that. Now I don't hear real great, so maybe everyone else heard it. But you were talking about testing, I think?
The mass testing clinics that are happening across the district.
Oh, okay.
I encourage everyone to look on our website, and maybe you might want to share where those are going to happen, but they are on our website so that individuals know that they can go out and get tested if they choose to, if they feel the need or have been at risk.
Yeah. So if of course, you can go to the Kentucky COVID-19 website, and all the providers in the state that are providing tests are listed. So you don't have to wait for a mass clinic to come to your county to get tested. But sometimes, after we see a significant burst of new cases in a particular county, we'll try to get a mass clinic set up just to ease people's minds. And so watch for those. I was going to share something else, and I think the thought has escaped me. Well, it has escaped me. I don't see any more questions, Tracy. We always conclude by saying our recommendation for the public is to, avoid crowds as much as you can. The more people you're around, the more likely one of those people is going to have this disease, which spreads very quickly. If you have to be around people, keep your 6-foot space bubble and wear your face coverings. That helps a lot. You're going to want to always wash your hands and sanitize well also. But, if we can do those things which are convenience, but minor convenience, that would really help. Certainly that's a far better situation than shutting down the economy or shutting businesses down. So let's all try to observe that guidance. I think that's all I have. Tracy, you want to sign us off?
Yes, thank you all for joining. If you have questions, I encourage you to send those to us by email, and we will be back next week, Wednesday at 2 o'clock to answer more questions from the community and the media. Thank you all. Have a great day.
All right. We'll see you all next week at 2. Thank you all.